Now you can hear me. Now you can hear me. Hello. Now you can hear me. Hello. Oh, it's just too loud. If I just unplug this. Can you hear me now? There we go. I wholeheartedly apologize for my pure ignorance when it comes to this software program. All right. So I hope at some point people will forgive me and will come back. If not, they can see this later and hopefully this will give them some information. Forgive me and we'll come back. If not, they can see this later and hopefully this will give them some information. So this is all about the spine this episode. As some YouTubers will say, the show. And so today I'm actually going to also upload a new video, and it's going to be on neck stiffness or neck pain and 3 different types of issues that go on in regards to your neck problems and different treatments that you can do at home to hopefully improve that. So stay tuned for that. It's this is the eastern part of the United States. It's 11:20 in the morning, so I'll try and get that up by 1 o'clock Eastern Standard Time. All right, hopefully more people come into the chat. But anyways, we're going to talk about the neck today, the mid back and the lower back and the actual sacrum. Just the basics. And hopefully when you guys come in, you guys can also chat with one another and hopefully get to know each other. And if you have any questions, hopefully I'll be able to go ahead and field those. Any of you guys have never been here before, my name is Joe, Average Joe PT. I'm a physical therapist. I've been a physical therapist for quite a long time. I don't want to give it my age, but I've been doing this for a while. And so you guys have any questions, just field them out. Let's start with the basics. Big purple here I got at the top is your neck, or also called the cervical. The blue part is your mid back or thoracic. Your shoulder blade on either side hangs on this area. It's known as a floating joint. And then we got the lower back, good old beastie green that everybody has problems with. And good old where my finger is at L5. L means lumbar, 5 means the 5th. There's 5 lumbar or 5 lower back vertebrae, and then you have your sacrum, or S is 1. So everybody who has back problems will say my L5S1. That's exactly what they're talking about is there. Then obviously you have your hips on either side, and then you got your femurs that come down and make up your legs and so on and so forth. But today we're just going to talk about this part of the spine, the neck, the mid-back, and the lower back. Oh, good. I got someone back. Thank you so much. You guys are awesome. Hi. All right. And so if we look at the neck actually has 7 little vertebrae on them. And if we look at how your neck moves in the different directions, the first segment, all right, which means is coming right from the base of the skull, this first bone right here, this C1, it's kind of an odd shaped little bone. It literally has a little round circle on the top of it, and then the second vertebrae below it kind of spins on it. And so that's how our head kind of swivels around. And so those two segments right there makes up 50% of the entire movement looking to your left and to your right. And so if you're having a problem in your neck, and if you can't move at all looking to your left and right, you always want to look at the first two segments, because that's where 50% of your movement is coming from. The other 50% comes from the rest of the spine here, down in the neck area. So half of it's coming all the way from up here for rotation. Now, if we look at the lower part here, right before we get into little blue here, this is the C6, C7 area. That C7 is that kind of big bone you can kind of touch there. That's your C7 before we get down into T, which is T stands for your thoracic. And you got 12 of those babies that go all the way down. And then your ribs kind of come out to either side and support that part of your spine. So when we look at your neck a little bit further, that segment right there, that makes up 50% of the motion looking down and looking up towards the ceiling. So if you're having any issues looking up or looking down, 50% of the movement comes from just that one spot. And then the rest of the vertebrae bones up in here make up the rest of that segment. So if you want to have issues looking left or looking right, 50% is up here of the movement. If you want to look down or look up, 50% of the movement's coming from that segment. And then the other little bones in between kind of make up the other 50%. So that's the basics of your neck when it comes to the motion of it. And the little discs are in between those little vertebrae, or what we call the bones in between are called vertebrae. It's a fancy word, but you can just call them spine bones if you like. They're tiny little discs in this area. There's a lot of sensitivity in this area. You got these little nerves coming off of the spinal cord. Think of, as my professors used to say back at Mercy College years ago, think of the spine and the spinal nerves as a tree, all right, that bark, and then all of the little limbs that come off of it, or the spinal nerves that make up your arms. In this case, in your neck, we're talking about your arms. And so any of these little nerves on the end can get pinched, whether it's being caused from a disc or whether it's being caused from the joint. So if I kind of come in close here for you a second, kind of come in real close, these little bones, these little things all the way down through, these are called facet joints or zygapophyseal joints, or Z joints, whatever you want to call them. I'll kind of give us a big close-up here, a big Bertha here. So if you have an idea here, we kind of think of it as we just like took one of the segments off and we kind of enlarged it and make it look like this. And so you have your spinal cord, then you have the nerves off of the end of the spinal cord. You have your disc in the middle that's kind of squishy. That kind of supports the old structure here. Then if we turn you on the back side, on skinny people, you can see these little bones on the back side of them. These are called your spinous processes. On fat people like me or other people, you don't really see it very much. Or if you're big muscular, all the muscles along the sides of the spine are kind of filled in. You can't really see that bone either. But on the either side of that, you have these little things, like I said, called your facet joint or zygapophyseal joint. And now they're in what we call a capsule. And so there's fluid that kind of nourishes that capsule. And this is where you can get a lot of pain and arthritis. You can see a spine doctor, an orthopedic. They might actually treat this area. We can talk about that if you guys have any questions. I got 3 people here. Three people. Actually, wait, I probably have 1 person. two chats, 2 people are from me. I have 1 person. And so, oh wow, it's my first one. Who knows what will happen in time. But anyways, I'm giving good information, and you guys can come back and look at this later. But I digress. And so if we look at this joint again, yeah, let me put this up so I can free up my hands a little bit. So if we look at this joint itself, and like I said, it's got a ligament. What I mean by capsule, it's like in a cocoon, and it's got what we call synovial fluid. So the joints in our body are kind of lubricated and nourishment that comes in and out to kind of protect the joint if it gets injured. It takes the bad stuff out and brings the good stuff in. It's actually done by synovial fluid. It's in our spinal cord too. The other part of our bodies, whether it's a muscle or something like that, or a tendon, or that's brought in and out nourishment-wise is by blood flow. But when it comes to this area, you wouldn't want blood in this area. Blood doesn't do well with cartilage; it chews it up. So, but anyways, and so that area, if you can get osteoarthritis, rheumatoid arthritis, it can really irritate this joint because the joint is supposed to glide on the one above and below, and if it doesn't do that, or if you have maybe you have a tight muscle or a spastic muscle, that can also get this whole joint inflamed too. And then obviously, as you can see, the nerves are out on the end here, and they can actually get that area all inflamed. The next thing you know, you have symptoms. In this case, when we talk about your neck, you can have symptoms going down your arm. Sometimes the doctor might send you to a pain doctor. They might do injections in this area. They're called facet injections. They'll put you they might do it in sitting, but they might have you lying down in your stomach too. If they're doing it in your lower back, they're probably having you lying down in your stomach. Or having you flex forward, but probably lying in your stomach. They'll go ahead and they have two main screens, x-rays, and that's actually called thoracoscopy. And so they'll go ahead and they can see the spine from two different angles. So when they bring in the needle into that area, it's a hollow needle, and then they can go ahead and put the medicine in through that hollow needle to this joint and basically bathe that joint and go ahead, if there's any swelling or inflammation around the nerve, then go ahead and it starts to at least concentrate in that area, and it can shrink that nerve and also decrease some of the inflammation around that area. So they might do a combination of a steroid and lidocaine in an area to numb the area, as well as decrease the inflammation. And so that's basically the facet joint and where you can get some of your pain at. Now, good old in the front, you have the good old disc here. As we age, the term called degenerative disc disease comes out. I wish that the World Health Organization or whoever out there that could change it, stop calling it a disease and just call it, I don't know, a syndrome, or just not a syndrome, but an age, I should say, normal aging process. And so what happens with degenerative disc, I had one neurosurgeon, a friend a long time ago. I hope he's doing well. He described, the neurosurgeon described the disc as, if it's healthy, it's kind of wet, slimy seaweed, and if it's degenerated, it's kind of dried out and grayish, and so it loses its viscosity or its ability to kind of fill back up. And so when as we go throughout the whole day, good old gravity pushes down, and when we go back to sleep and wake back up the next day, the disc kind of has more fluid back into it. And so yes, you are taller in the morning than you are in the evening, though it's very small. I always love that one. But anyways, and so that degenerative disc, let's just say that it is flattened down. You can see how it can stress all those little facet joints on the side and make them kind of stretch out a little bit, and the muscles want to collapse down. So you get this tug of war between what the muscles are happening and where the joint. And so it's very, very possible that degenerative disc could be not the primary cause of your pain. And so when I see a lot of people in my clinic and they say, I got degenerative disc disease, I always like to say, hey, it's a normal process. As we age, you might have no symptoms with it. These people get these x-rays or the MRIs, and the physicians, obviously, they don't have a lot of time in their hands to kind of sit down and talk to these patients. It's just the reality of healthcare nowadays. And so I guess us as physical therapists, whether you're physician assistant, nurse practitioner, we're all got the same education level. We have hopefully a little bit more time to sit down and at least give the basic information to the patient or client, whatever you want to describe, label them nowadays, and take the scare out of them a little bit, because I spend a lot of my time doing that. And the simple answer is this: you can have a test, and the test be what's called a false positive. heck is that? People will say false positive essentially is that the tests are so good, they're so detailed, so sensitive, they might actually show something in there. It's not actually giving you the problem, it's not giving you the pain. So you might have that degenerative disc kind of flattened down in there, but that's not where your pain's coming from. It could be coming from the facet joint, it could be coming from one of the ligaments, it could be coming from the actual muscles themselves. So there's a lot of reasons why you might be having pain in your neck, your lower back, or your mid-back area. It might have absolutely nothing to do with the degenerative disc that you've probably had for years, and until you had the test done, you didn't even realize it. And so as we age, we have normal degenerative problems, okay, or degenerative disease, whatever you want, DDD, if you want to continue to label that. Though might not be giving you the symptoms. I just really want to kind of overlay everything, essentially just say that. Oh, hi! I kept spewing out and I didn't even look. I'm so sorry. Hi. Hello. I'm just asking my audience if they have any questions, because they were beautiful people and they were willing to spend a little bit of their time with me. That's a beautiful thing. People willing to spend their quality time to hopefully learn something. Maybe just give this information, maybe in the back of your mind, someone, one of your family members, can easily have this problem. So let's go ahead, and I'm just going to bring little mini-me up here. Cute little thing. And I love when I got this. I thought this was the sweetest little thing. She's a little stiffer. But this really shows the little things, the little yellow things basically show the nerves that come all the way down through. And on this model, it actually shows a disc problem where it can actually pinch against the nerve. Now that's possible. Usually as physical therapists, we might see that if it's a trauma-based. A lot of times when we see a person with back problems, it's usually either they're having muscle spasms or they're having a degenerative disc secondary problem causing a lot of the issues. In this case, along the back side of the joints. As you can see that in the big bertha here, you can actually see the joints much better. And so that's the real issue. Now, I notice a lot of lower back issues are coming from, at least the ones that aren't trauma or sports related, are truly due to sitting wrong or sitting too long or sitting incorrectly. And so I started this slogan years ago. I got a good friend where I used to work up north. Love him dearly like a brother that I once had. And we talked about good old magic towel. And so I'm going to keep chugging at this old magic towel trick because it truly does make a difference. You ain't got to buy all that nonsense that's out there in the market. It really is there just to steal your money. I'm here to really give you the honest opinion of someone who's got some decent education and some decent experience behind them. That 9 times out of 10, all you really need is some sensible thoughts, and you really don't need to go out and spend your hard-earned cash on some of this nonsense that's out there on the market. Now, I can go over it an exhausted amount and stand on my podium all day about that, but I love my people too much to do that. But let's go back to magic towel. And so what you want to do is you want to just take a towel and roll it up, and put a piece of tape around it. And essentially, if you're sitting and you're having some lower back or you're having some pain down in the buttock or hip area, you really want to just either sit back in the chair and take that letter C that I call it, take that letter C out of your lower spine. The little mini-me can't take this very long. And so you can see how the joint starts to take a lot of stress in that area. And so if you sit back in the chair, all the pressure's going through your little hip bones. See these little hip bones? These big hip bones here on either side? That's where you want your pressure. These are solid bones. These babies are designed to take the weight. your spine is designed for movement. It's really not designed to take a lot of load for long periods of time, which is what happens when you sit incorrectly too long and you start stressing that joint area. You start stressing this joint area, and you're going to get a lot of pain with that. So you just take that towel and just stick it back there. And where is it going? That towel is sitting back literally like this. We're taking the hinge joint out of your lower spine and just making sure that you sit on your hip bone, or your these are called your ischial tuberosities. If people are wondering out there, hey, this guy doesn't know his terms. I know my terms, trust me. I've been doing this long enough. I just don't want to bore the public and all my beautiful members on all the terms, because I'm not here to impress anybody. I'm here to help people. But you want your weight to be on these bones here. All right. And you want to go ahead, you want to rock like this. You don't want to sit down in, because when you sit down in, all you're doing is basically flexing that lower spine. You're putting a lot of stress at this joint. This L5S1 takes a lot of stress. It gets inflamed. Next thing you know, you think you're dealing with a disc problem, and essentially all you're dealing with is inflammation. That's what a lot of the doctors are going to get. When you go to your primary care doctor, those beautiful people, there's only so much that they can do for you if it's not a trauma, this is chronic. They're going to give you, if they're beautiful enough and nice enough, they might give you a steroid shot, or they might give you some oral steroids like prednisone to take for maybe a 3-day or 5-day or 10-day pack to cycle down through to reduce that inflammation. They might give you some muscle relaxers, like Flexerol or cyclobenzaprine or something like that to reduce some of the muscle spasms that you're having. Essentially, they're more like a sleep aid. I digress to this point. The point I'm trying to make here is if you don't change the way you're sitting and doing things with your lower back, once that medication wears off, you're going to have the inflammation is going to start right back up again, and you're going to have the same problem that you had before. So, all those medications that these doctors given to you, they will work. They do work. They're meant to be taken forever. They're meant to get you over the hump of your pain cycle, and hopefully, either give you enough education that, or refer you to a specialist like one of the thousands of physical therapists that are out there in the world that are trying to make your life, make their life, and make everybody's life a little bit better and less pain. You gotta listen to them. 99% of low back, mid back, and neck pain is education. If you keep doing the same things and they're hurting you, you're going to keep getting the same problems. So, wait, that's insanity. Doing the same thing expecting a different result. That's right, that's crazy. Here, let me get a drink of water. I'm getting a little parched here. So, arthritis in the joints. You can have muscle spasms. Now, I go over my next video goes over a lot of postural things, like if you're over elongated, and that makes all those muscles overstretch for long periods of time. All right, you have these things called active and latent trigger points, and they can be in two groups. So you have either central trigger points or you have satellite trigger points. So just stick with me for a second. So just think of central as that's where the main problem's coming from. All right, and then you have satellite is where it's like that central is causing another little latent trigger point, which is an area that isn't giving you any problems, all of a sudden start to give you some problems. What the heck is a trigger point, right? That's the first thing. And so I go over my next video that I'm going to bring up about 1 o'clock Eastern Standard Time. Essentially, when you look at a muscle where the muscles and nerve endings kind of meet, and if that area gets inflamed, you're going to have a trigger point, an active one. You can push on it, you might be tender or sore. That's a latent trigger point. But if you push on it and start shooting somewhere, whether it's in your mid-shoulder blade area or up in your neck area, that's called an active trigger point. The issue is your body builds up toxins, lactic acid, and other metabolic types of chemicals, and if you're not relaxing, and basically letting those muscles open and close, all right, bringing that blood flow in and out, it's going to build those toxins, and it's going to sit in that muscle belly, and it's going to get irritated. And it's going to get irritated more and more, and next thing you know, you're going to have a trigger point. You get in a car crash, and it's a cascade. Your active, all your latent trigger points turn into active trigger points that you never thought you ever had in your whole life. And so be mindful of not only just like, I don't have any pain right now, but the types of posture exercises that I go over and the positions that I put you in. They also can help you, so God forbid that you actually do hurt yourself down the road or fall or whatever like that, that you already have set your body up, so if you do get hurt, you can recover that much faster. Because if you have a lot of latent trigger points in there and you get a quick stretch pain or something like that, you could be messing with a lot of problems. So, muscles along the base of your skull are called suboccipital muscles. They can give you a lot of weird symptoms like vertigo and lightheadedness. If they get inflamed and irritated, and that can take several weeks to calm down. You can have, what I talk about in my one video is you can have these kind of stress type headaches that come up over the top of your head. This little thing that can move back and forth is called your myofascial area, and you get a lot of pain that can kind of generate through that into the muscle area. So, hi. This is my first one, folks, so I'm hoping, I think what I'll end up doing is broadcasting probably, this next week, saying, hey, I'm going to do a live stream on whatever day, and we're going to talk over whatever you would like to talk about. But I do appreciate... Oh, okay. Hi, lady. Thank you so much for staying. You're so sweet. Do you have any questions at all? I mean... I am at your disposal. I'm a guy with over 20 years experience. I've done outpatient, I've done inpatient, I've done nursing home. I've done a little bit with the kids. What else did I did some pool therapy for a while. I did some work hardening. I mean, I got a lot of experience in different environments. So, I'm not someone that just started yesterday. So if you have any questions, I can either lead you in the right direction, or I can find it in the top of this crazy skull of mine. But barring Mr. Scully and me, I know. Some people think, hey, Scully's great. He's a good little comedy act for us. And so he kind of takes the chill off of the dry and the mundane and the nonsense. And so, all right. And so, we can go over the parts here like I did before. So we got the spine, the spinal cord. You have the nerves that come off the spinal cord. The spinal cord itself comes all the way, obviously, from the brain. That's a good idea for me. Maybe I will, one of my little things, maybe I'll pick up a brain model. And like we can go over parts of the brain. If someone has a stroke somewhere, what type of symptoms would they have, because, maybe one of you guys out there have a family member that had a stroke, and you're like, what's going on? Why can't they talk? Or why are they talking gibberish? Or, we can go over some crazy terms like expressive aphasia and receptive aphasia and Wernicke. I mean, there's a whole physical therapy, what's the best word to say, specialty or field just in people who've had strokes and traumatic brain injuries and concussions and stuff like that. Those are some beautiful people, because that's hard. I did that for a little while, full time. I do it, part time now, as well as I do some orthopedic stuff. But those are some beautiful people, because you can get burned out doing that stuff. So power to those people. That's a testament to people when they can see, spinal cord and brain injury and traumatic and stuff like that, all day, every day. And sometimes they get better, and sometimes, they get as good as we can get them. So, that being said, oh shoot, I lost my train of thought. Oh yes. So we talk about the brain here a little bit. And so maybe one of my next models is I'll talk about that, but let's go back and we'll talk about the spine, because that's what this this basically this show, this episode's all about. And what I was talking about is the spinal cord comes from the brain, goes all the way down through this canal in the back. You see, so you got your, so if we looked at, this is the front side of you, or us, I should say. And your brain, obviously at the top, there's a hole through that skull that the brain comes down through, and it's called the brain stem, and it's got different parts to it. I'm not going to bore you with that. But it turns into the spinal cord, and then off the spinal cord comes these little nerves. It comes all the way down, and it ends about L1 or L2. Some people are T12. I usually say L1. I guess maybe on exam. It depends on the person, you know. We're not cookie cuts people. There's a lot, you know, that's a nice little episode I could talk about too, is the differences in humans and how sometimes people think we're cookie cuts. Sometimes we have tendons that other people don't have. Sometimes we have muscles that, you know, I'm pointing here because there's certain people that have a certain muscle in the wrists and other people don't. People can get all kinds of different weird abnormalities in regards to how they grew, and they might have certain tendons or ligaments or things in different spots that everybody else doesn't. So that'd be a cool episode. You know, if you guys want to shout out for that, that'd be a nice episode I could do. But the spinal cord ends at about L1, and then from that part, it just is kind of these little nerve endings that come all the way down through. All right, and it's called the cauda equina. What the heck is that? It's just a fancy, you know, it's Latin. You know, the dead language. But anyways, it's called the horse's tail is what that stands for. And obviously someone a long time ago in a land far, far away thought that the nerve endings looked like a horse's tail on the back. And I guess if you had to name it something, I guess that's better than anything else. That's probably why we have never changed it. But that's essentially the spinal cord and the spinal nerves that come off of it, called the peripheral nerves. And then it ends, and then it comes all the way down here, and we're going to go down into the dreaded sciatica. And so people who have pain in their butt cheek or down in their leg can have some sciatica pain. Now, let's see if I got any more people. Oh, good morning. Hi, Life. Hi, Life. Thanks for coming to my first stream. Now, if you guys like this stuff, you guys hear me pretty good? Let's see how I sound. Oh, okay, yeah. All right. That don't sound too bad. This camera brings it up pretty good. But if you've ever heard of the sciatica or pain or nerve pain down the leg into the foot, that's your sciatic nerve. Now, you can have, there's two other nerves, the femoral nerve and the obturator nerve, but we ain't got to go in. We're just going to go into the basics today. We'll leave that for another episode. I'm going to represent the pen. Let's be funny. Let's represent the finger. And so this little nerve, the finger coming out here, that's where the nerve comes down through. And so this thing is called your sciatic notch. And it's pretty huge. I mean, boom. Now you have a muscle that can go above, below, or God forbid, on some people it goes in between. Now that's called your piriformis muscle. Now there's a whole piriformis syndrome. I think I did a video a while back with hip pain and talks about that. You know, you have people out there, some people say stretch it, some people say strengthen it. The reality is this, not knowing whether the piriformis and like I said, humans have abnormalities. Your piriformis isn't always in the same place. Some people it's above the nerve, some people it's below the nerve, and some people the muscle actually splits it. And that's the person that has a problem, because if that muscle goes into spasm, it's going to choke on that sciatic nerve, and they're going to wish that they weren't alive at that point, because their whole leg's probably going to go numb. And that's not a good thing. Now, sciatic nerve is kind of funny. It can be the whole shooting pain down the leg into the foot, or it can be spotty. You ain't got to have the electrical symptoms all the way down into the foot and toes. Let's see Mr. Foot here. Or Mr. Foot here for a second. And so, if we look at, this guy's missing a few bones here, isn't he? He's missing rest of his tibia, which is your shin bone. He's missing part of his fibula. Oh well. Maybe we'll get a whole skeleton at some point. Maybe. But anyways, coming out of that sciatic notch. Okay, we're putting on a little mini-me because it's easier for me to handle. It comes down into the leg and then makes up your knee, shin, foot, toes. And so anywhere along those lines, if that part of the nerve is inflamed, all right, because that sciatic nerve is made up of a bundle of nerves, peripheral nerves here, all right, and they all come down in and become one big module of nerves, big bundle, I should say, and then they split and they turn into different names, but essentially it's still your sciatic nerve all the way up here into your pelvis area. So if you're having any issues in your lower back or in your hip, it can travel all the way down to your foot or be spotty, like I said. You might have no back pain and just have some weird symptoms in your calf. You're like, what the heck? Does it feel like a tight numbness? Or it might be just like your big toe is numb, or parts of your bottom of your foot or top of your foot are numb. Now that could all be coming from your back. Now, it could be coming from anywhere in between there too. You could have what we call a double crush injury, where you're having some symptoms on somewhere along the line in a couple places. You would have to see you can do an MRI to really tell what's going on with that. You could do what's called if you see probably a neurologist, he would do what's called a nerve conduction velocity test or exam. Essentially what they do is they put little needles along the track of which nerve they want to test, and each nerve has kind of a baseline speed. And so let's say, I'm not going to go crazy, but let's just say it goes 1 mile an hour. Obviously that's not the case, that's not how the units, but just for simplicity purposes. Let's say that nerve normally goes 1 mile an hour, and it's going 1 mile an hour halfway down through your hip and in your leg, and all of a sudden it goes down to 0.3 of a mile per hour, and so it's slowing down. So somewhere along that track, above or below, the nerve is being affected, and so that's what that test really shows. It shows which nerve and where or about where it's being affected at. And so a nerve conduction velocity exam could really give those physicians a really good idea what's going on. Now, if you ever get some what's called epidural injections or spinal blocks or something like that in your back to reduce your pain, and people say, well, I did the shot and it didn't help, or it only helped for a few days. Oh, thank you, lady. That's so sweet of you. Hi, Bella. Hi, Bella family. These people are just so sweet. They work just as hard as I do, or harder. I'm sure they probably work even harder. I'm trying to go 900 miles an hour. They're going probably 1,000,000 miles an hour. All right. Oh yes, we were talking about the speed of nerve, and so getting an understanding of what that nerve, what the speed is, and where it's being slowed down at. And so, like I was saying, you get an injection. You might get an injection, and they might the physiatrist or pain management doctor, so there's going to be basically two types of doctors that usually will do the spinal blocks. Those usually physiatry, all right, or an anesthesiologist. Those are, you could probably get other ones, but those are kind of the two types of doctors that will go ahead and do these types of treatments. And so people will come to me and they'll say well, I had an injection done, or I had 2 of them. The first one helped, the second one didn't help, and so I didn't go back. I'm like, oh God, you should have went back. The reality is this: it's not only a treatment, it's a diagnostic tool. And so that doctor, he's going in there and he's trying to figure out, all right, I have a pretty good idea where this pain's coming from. Let me just hit that spot this time and see if it works. If it didn't work, that doesn't mean you don't go back. You call them up, or they might say, hey, they might schedule you 3 weeks or 4 weeks or 6 weeks down the road. Go back, because you can tell them, hey, it didn't work at all, or it worked for a few hours or a few days, because that kind of gives them a good idea. You know what? I typed in my notes, if this didn't work, I want to try this next time. So they might go in and hit a different spot or above or below that nerve the next time, and that might really help your symptoms. So it's a diagnostic tool as well as a treatment, those injections. So be very mindful. All right. These doctors, they're not dumb. They might not have bedside manner, and trust me, I'm hoping the schools nowadays give some of these doctors a bedside manner. Some of these doctors are absolutely beautiful, and some of them are absolutely a-holes. And they know they are. That's the bad part, is when they know they are, and they are anyways. But I digress. Some of them are egomaniacs. But oh God, don't get me started on my platform. But anyways, be mindful of that. These doctors, they know what they're doing. Just go back. I usually tell people, and the doctor will say, they'll do a cycle of 3. Come back 3 different times and see if it helps your symptoms. And that really will help. Sometimes he might send you to physical therapy. We might put you in the pool. I have a pool where I'm at. We might put you in that for probably 8 visits, 6 or 8 visits, and see if that really helps give your symptoms a break. And so what that does is, obviously, when you're in the water, I kind of give you a little hint of Archimedes' principles here a little second. But when you're in the water and you're about belly waist height, you weigh about 50% less. So let's say you weigh 100 pounds. All right, you're only moving 50 pounds of weight when you're actually waist deep in the water. When you're about nipple or chest height, you're only moving about 20% of your body weight. So if you weigh 100 pounds, you're only moving 20 pounds. And if you're at your neck, you're 90% unweighted. And so you're only moving, if you weigh 100, you're only moving 10 pounds. So 90 pounds of you is unweighted. So that starts to give a nice little distraction or pulling sensation down. It gives you a nice little traction that can relieve some of the joint pain and also give some nice gentle stretch to the spine. And so some people say, well, I feel really great in the water, but when I get out, I hurt again. Yeah, that's gravity coming back to show its ugly head. Gravity's good, but it also can be bad when you have some back problems. But realize that when you're in the water, make sure you don't do too much, and you kind of work your way through it over time, because if you hurt too much the first time, 30 minutes is more than enough. If we're dealing with someone who's got chronic pain and they're in the water, 30 minutes is enough. Let's see how they do the next few times, and then you can go ahead and progress that. So that just gives you an idea of how the spine actually gets unweighted when you're in the water. Oh boy. Thanks, life. Yeah, I got someone kind of spamming a little bit. Come on, skunk water. You and me, I thought we had something. You can't just start spewing that stuff out. I love you, man, but start doing that stuff, and then we're going to get my live stream pinged on me. Let's see how I can get that off of there. I'll figure it out somehow. All right, how do I live stream? Chat, live chat. Show me live chat. Oh boy. I'll have to figure this one out, folks. Well, thank you. Thank you, skunks. Thank you. I'll figure out how to do this later. What can you say? I'm an overeducated idiot sometimes. At least that's what my family says every once in a while. Hey, this kid is an overeducated idiot. All right. Thank you, skunks. I really do appreciate that. That makes me want to go watch 5 of your videos right after this. I promise you I will. I don't break promises. Okay. So, if you guys have any more questions, go ahead and fill them in. I don't see any yet. You guys are just showing your love to each other. I do have to figure out, I'm sure it's pretty simple, to delete. Oh, thank you. Thank you. That's very nice of you. All right. So I'm going to actually... No, that's all right, skunks. I'm absolutely horrible with names. Godlina. I guess that's how I enunciate your name. Maybe if I get enough practice with your guys' beautiful names, it's they named me Joe after my my two grandfathers, Joseph Frederick, and so my one grandfather was Fred and my other grandfather was Joe. So I'll give you a little sad story. They both passed away before I was born. So wherever they're at, I hope they can see we're doing all right. Okay, so we talked about the spine, all the different little vertebrae. We talked about the nerves. We talked about the spinal cord. We talked about where your pain can be generated sometimes, whether it's coming from the joint or whether it's coming from the muscles. Now, let's just talk about the lower back just for a second, because most people, they're going to have low back pain. If you're on this planet long enough, you're going to have low back pain. So I already talked about, the sitting issue, and if you sit incorrectly. What you want to do, I'll give you a little caveat. This one's pretty simple. Lie on your stomach. Yes, that's right. You're going to start with probably 1 or 2 pillows at the belly button. What that does is it keeps you from overarching or extending your lower spine. So it kind of keeps you in kind of a nice, straight, flat position. So that takes some of the stress off of this joint on either side, because a lot of your pain's coming from there as well as the lower back. So when we talk about the lower back, you have literally 3 layers of muscles in your lower back. My one anatomy professor, when we dissected the human years ago, she was a beautiful lady. I think at one point she was the professor at Einstein University in New York City. I hope she's still there. She is. Hi. She probably will never see this. But anyways, there's 3 levels. There's the deep, and the deep muscles. And so literally muscles in your back, in your lower back, they can run vertically, okay, and then they can run obliquely on one another. Muscles aren't like what people think, big round stuffy things. They're flat, smooth surfaces, and they're in these little sheaths, okay, called the myofascia, and that's how they glide on one another. And so when one area gets inflamed, it literally cascades, boom, 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 through those 3 layers, and all of a sudden your whole back is locked up and you can't move in the spot. And so the best thing you can do is get yourself on your stomach. I know it's crazy as it sounds, but 1 or 2 pillows, and put all those muscles back into a shortened position. You don't want to sit or stand. You're going to put them in over elongated or stretched position. You want to be in this position and throw some ice on your lower back for 15 to 20 minutes. Stay out of sitting completely, probably 72 hours straight. So these muscles in the inflammation period, that's the reason why I always say 72 hours. That's the normal inflammatory process of the body, is 72 hours. And so you can go ahead and get that process under control with ice. Now, you could try some anti-inflammatories if you don't have a stomach problem, or if you don't have a blood problem, or if you're not on some sort of heart issues. You could try some simple anti-inflammatories for a few days. But that's the best thing you can do, 3 or 4 times a day on your stomach for 15 to 20 minutes with ice, and stay out of sitting position. That'll definitely make your symptoms feel much better. And so the big muscle, I talked about this, I think I did a whole episode on the multifidus. Probably it's in my back playlist anyways. But that's a big meaty muscle, and it's crazy when you strain that muscle the first time. Your body can recover pretty quick as long as you don't keep beating on it. You strain that muscle group 3 or 4 times, and as you get older, like me and my beep 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 years, you get up there to 30s, 40s, 50s, and so on. That muscle starts to shrink when it can't. You keep beating on that, and you sit incorrectly. You give it a few days, you take some pills, and you keep doing the same problem. That muscle starts to atrophy or shrink, and over time, it actually can start to have fat deposits within the muscle belly. That's right. Instead of having muscle there, it turns into like a gelatinous fat area. And so now you're in real trouble. Now the joint and the disc is going to take all the beating instead of that nice, healthy multifidus muscle that used to be there. And so it's very important if you're having a lot of chronic back problems that you look at that video. Now, you can skip through all the nonsense, the show and the flash. I think it's somewhere probably in the 4-minute mark or something like that, where I really start to talk about the multifidus and some exercises, or I kind of put in my videos towards the end. But those are some decent exercises that you can do to kind of strengthen the multifidus muscle back up, because yes, you do have some small muscles that sit right in the vertebrae themselves. Let's see if you can see me. Yeah, you can see me pretty good. I digress for a second here. Let me just make sure I haven't missed any of my beautiful people. All right, skunks. Oh, thank you. That's one thing I need to do is definitely look at you guys more so I can kind of throw the comments and guys give you some information. So I got beautiful skunks here. He's saying that he's had some back problems since he was 17. And so that makes perfect sense, skunk. I guess I'll call you skunk. I don't know your real name. Anyways, I'll call you S. S sounds kind of cool. S for Superman. And so you get about that 17, 18 year mark and puberty kind of finishes up. And so your, what we call your growth plates finish up. Boom. All right. And now you're done growing. And so this lower back starts to, at that point, your metabolism, everything starts to slow down. And essentially, if you have any type of if someone's missed through you when you were young, missed a little bit of a scoliosis in your lower part of your spine. Now I could go into scoliosis. There's different kinds and different descriptions, but if let's say you had a little bit of a tilt or a little bit of rotation down. Now this guy doesn't twist too much, but this guy does. If you had a little bit of rotation and spin a little bit, well, I don't want to break little guy here, but in that lower part of your spine, this kind of shows even better. So let's say you had a little bit of rotation there, or a little bit of a tilt, and they never caught it, and now all of a sudden your growth plates are completely healed up. Now we're dealing with these nerves around the peripheral area that come down in your legs and in your feet. Now they don't have the movement like they used to, because you were still growing, everything was still kind of going in an upward vertical position, and now the growth is finished, and now you're kind of set in one spot now. Now it's like these nerves can get irritated very easy. And if you're a very flexible gentleman, Mr. S, you're flexible like that a lot, that can put a lot of stress on that joint. And be mindful of that burning sensation in your feet is coming from those peripheral nerves off of your spine more than likely. And so be mindful that you're not doing a lot of that what we call sacral sitting. And we say sacral sitting because you're literally sitting on your sacrum because you're rounding your lower back instead of sitting on what we call your ischial tuberosities, or your ischiums here, your butt bones. All right, so yeah, they get inflamed. You get burning in the bottom of your feet. If we talk about when you have numbness or tingling or burning and there's certain parts of your leg, that kind of reminds me there, S, a little bit, or skunk. Your legs kind of tell us, the professionals, what nerves and where they're going to. There's a term called myotome, all right? That's essentially telling us what nerve is affecting what part of the leg. And so let's say, like S or skunk, he has symptoms in the bottom of his foot. And so that's telling us right then, if he's got burning in the bottom of his foot, is coming from his S1 nerve. It's coming down low. Now, it might intensify and reduce. He might get some weird calf tightness, or maybe in the buttock, or maybe radiating into the hip a little bit. Because you can have both problems. You can have radicular symptoms, which means that passes through the leg, and you can have radiating symptoms that's just coming from the lower back into the hip area. It's kind of like if you had a kidney stone and you have some back problems, but it's actually coming from the kidney stone. That's radiating pain from the kidneys going into the lower back. And so let's say you have a joint problem or a muscle radiating into the hip area or the front groin area versus radicular going all the way down your foot like Skunk's is. His is going burning into his foot. And so I would tell him 72 hours lying on your stomach. If he loves to, I'm not sure how old he is, but if he likes four-wheelers, if he's doing a lot of jumping or anything like that, that's a lot of bouncing on your lower spine. And just be mindful of, you probably should, let's see, if you just lied on your stomach for 3 or 4 times a day for 15-20 minutes with ice on your lower back and see how soon your foot symptoms goes away. If that's the case, Skunks, I want you to look, I mean I know I'm promoting here, but you know, take it as you want. But I have a video on there that talks about, it's an older one. It's got good content, but the video kind of, it sucks a little bit. But it goes over, it's the disc one. And you might not have a disc problem, you might have a set joint or something, or just something's inflamed, but it's got the exercises under the disc one that can kind of give you an idea of maybe that will help your symptoms. And so you could try that for 3 or 4 days to see if your symptoms get better. If it does, you can go ahead and go Google with that program, and then maybe go into my one program that I talk about core stability and strengthening exercises, and so that you kind of get your core and your pelvis strong again, so that you can sit the way you want and your symptoms won't come on. So you can try those few couple of videos, Skunk. Hopefully that helps you a little bit. Oh, how long have I been on here? Alright guys, I've been on here almost an hour. I'm going to give myself about 4 more minutes. If I get some more people in here, that's great. Otherwise, we'll go ahead and we'll call it this session. I want to thank all my people that actually came to the live stream today. And you know, I didn't even promote it at all, so that's a beautiful thing. So Skunk, if you see this live stream again, and I'm just gonna put it up on a link. Hopefully you can go back. I want you to look towards the end where I talked about this particular issue, and hopefully it might help you. But like Skunk had, he had symptoms down on the bottom of his foot. And that's coming from probably, now you could have what I talked about earlier in this live, you know, double crush injury. You know, you could have problems anywhere along the track of your leg, but it's probably coming, you know, depending on how old you are. You said since 17. I don't know if you're 19 or if you're 103, but excuse me. It could be, you know, coming from, like I said, the S1, because that's the spot where that nerve kind of comes into. Now, if you're having some, you know, your big toe is also numb, or if you're having some weakness in your big toe, that's an alarm, because there's the track of your nerve has 2 things. It has sensory, which is your sensation, the burning, the numbness, the pain, and it also has 2, motor. All right, motor is a huge thing. The motor is basically your foot or your leg or whatever moving. Your nerves do 2 things, and so if you're having weakness in your big toe or your ankle, you need to go see a doctor immediately. Go see a professional, because now you're dealing with some muscle weakness. That nerve is getting inflamed to the not past sensory, but also motor now, and that's a red flag. If we talk about as professionals, we got our green flags. It's good. Go ahead, treat them. There's yellow flags. Something might be leery. Red flags, refer them back. If you're having weakness and stuff like that in your big toe or your ankle, you need to go see someone. Don't ignore that, because you could get permanent damage in the nerve if you let it go long enough. And so I hope you guys like this first live, and I'm gonna bring plenty more. Hopefully, I can take all this brain knowledge and take it out into the streaming world, and hopefully we both can, or actually I should say all of us can grow together. So until next time, Scully and I want you to look up and keep smiling. See you next time, folks.